Long-Term Care News, and I'm talking here with Dr. Neil Kurtz, President and CEO of Golden Living. Dr. Kurtz, there's a move among long-term care facilities to treat more high acuity patients. How is Golden Living taking advantage of this or trying to capitalize on this trend?
Well, we think we're very well positioned to take care of these medically complex patients. We offer a diversity of services, our skilled nursing, rehab, hospice, home health, and we can provide that continuum of care that these medically complex patients are going to need. So we have invested a lot of money and a lot of time in thinking about how to appropriately treat those patients.
Mm-hmm. And so how are your facilities changing to accommodate these complex patients?
One of the most important things we're doing is increasing the number of our RN staffing. We've taken a hard look at the number of RNs, and we're in a hiring mode. We're dedicated to increasing the amount of trained RN staff. We're also taking a hard look at physician extenders, like nurse practitioners and PAs, as well as evaluating what the proper relationship is with our medical directors and with other physicians in the community. Because it's all going to play a role, very important role in taking care of these medically complex patients.
Rehospitalization is another really big issue in long-term care now. CMS is cracking down on rehospitalizations. What do you think about that? How are you doing?
Absolutely. I mean, everybody's talking about it, but this is not a simple issue. The more you get into what is a rehospitalization, the more you realize that it's actually quite an interesting process of defining what it is. We are spending a lot of time thinking through what it's going to take to decrease rehospitalization. It's not going to be simple. It's going to take a combination of training, increasing staff, technology investment, and partnering with the acute hospitals.
Mm-hmm. Can you just expand a little bit on that? Because I know that a lot of providers are talking about now sort of bridging the differences between the different providers.
Well, if you take a look at the relationship right now with the acute providers, I define it as very transactional. I mean, you talk to the discharge planner, you talk to the physician on a case-by-case basis. While I think that's going to continue, I believe the future will move more towards an enterprise type of sale, where companies like mine will go to C-level suite executives at these medical centers and talk about how one can create win-win situations for specific types of patients. So the respiratory type patient, the cardiac patient, the renal patient, these are all going to represent very attractive opportunities to partner with acute hospitals, with companies like ours, and to be able to provide that spectrum of care across the continuum of services that these patients are going to need, and avoiding the rehospitalization that these C-level suite executives do not want to see.
Thanks for spending the time.
Thank you.